Good morning, ladies and gentlemen, Excellency. Please take a seat. This will be something very important. So I hope you are comfortable sitting there because we have critical message for all of you. First of all, before we start, we need to acknowledge and recognize the presence here of the Ministry of Health from Belgium. After what's happened this night, we are all with you and all our sympathy for the terrible attack that was committed yesterday in Brussels. Thank you very much. And thank you all, our sympathy. Critical moments for peace. Thank you all for being here. The idea is very simple. We want to take you with us on the road to COP28. And as you know, this road has been a long one, not ending in Dubai. On the contrary, we are starting something fantastic in Dubai. First of all, I would like to recognize and express again our gratitude to the presidency of COP28 for allowing us to have, for the first time ever, a health day. So thank you very much, the COP28 delegation and the Emirates. We will try to tell you why we thought, and in WHO with the global health community, we have been pushing for this recognition of the health at the COP28, at the COP in general. The reason is that we want to make sure that the voice of the health community at large will be very much at the heart of the negotiations, because the negotiators need to understand that whatever decision they are going to take will affect our health. On a good way, if they take the right decisions on mitigation, on a bad way, if not. And that's why we want to everybody saying, this is the voice of the health community telling you how much climate change is devastating human health, having a problem, creating very negative impact on our health. The second message, we want to make sure that everybody understands as well that there are very positive health outcomes that can be obtained if we engage on mitigation strategies, if we reduce the combustion of fossil fuels. One of the most immediate benefits will be the reduction of air pollution and therefore contributing to reduce those 7 million deaths that are occurring every year due to exposure to air pollution. We want to present the health argument, the positive argument for more ambition, more action on climate change. And we want as well to tell you how the health community will be preparing for this big health day, which is not just an historic day, it has to be a big legacy where the health sector, the global health community will be moving on it, unlocking the funds that are needed to support the assistance that we need to provide to those countries who are the most vulnerable and probably the ones that didn't contribute at all to the climate crisis. Climate crisis, health crisis, but let's talk as well about health opportunities. And that's why we will try to give you a good view today. We will start with a regional focus, then we will be moving to the COP presidency to tell us where we are on the declaration and on the events that we are organizing. You will hear from ministers in Africa how the situation is affecting them. And then we will have a very good discussion as well with other panelists that I'm sure that you will love very much, reminding us why are we here, how is this affecting our health, and what are the best solutions as philanthropists, as the private sector, as engaged people, and as communicators, how we can move this agenda on the most positive and the productive and impactful way to protect the health of our people. With that, let me invite to the stage my very good colleague, Dr. Maassen, who will be representing the regional office in the Eastern Mediterranean. Please, Dr. Maassen, you have the floor.
Excellencies, ladies and gentlemen, Assalamu alaikum wa rahmatullah, good morning. I'll be speaking on behalf of Dr. Ahmed al-Mandari, who, because of the turbulence in the region, was not able to come. Before giving you the 4 or 5 slides, allow me to show you a short video on the urgent need to act on climate change now, not tomorrow. Please.
Climate change is here, happening faster than expected, posing the single biggest health threat to humans and communities. Direct and indirect effects of climate change will cause an increase in mortality and morbidity rates, changes in the burden and distribution of many climate-sensitive diseases, with vulnerable groups facing more drastic health outcomes. Recent floods we've seen, dust storms, polluted air, the heat we're living, droughts spreading, raising sea level, all will affect our health, putting more pressure on health systems and service delivery. Do we need a new pandemic to start acting? We need to build our health systems to be climate resilient and environmentally sustainable through oriented leadership and governance, climate smart workforce, climate risk assessments and early warning systems, more resilient and sustainable supply chain, emergency preparedness and more informed programs, and sustainable finance. Every effort is crucial if we want a health system that can protect our health and future generations. Without action, climate change will undermine decades of progress in global health.
Excellencies, ladies and gentlemen, there is a big reason to be worried about our future, the future of our kids. Climate change hazards are changing in a stronger and faster even trend than we anticipated. In the Eastern Mediterranean region, unfortunately, we are seeing it very harsh. Our environment is already fragile. And temperature increased in 2022, for instance, in about 1.84 degrees from the industrial agent. And that's even higher than the global average. Just presentation, please. As we shared in the video, climate change is affecting the health sector and the health workforce and our public health just right now. We've seen the deadly flash floods in 2022 in Pakistan and in Libya, where tens of thousands of people, tens of thousands of people lost their lives, hundreds of thousands or millions of people lost their households, thousands of healthcare facilities were destroyed, leaving millions of population without health services. This is a hospital in Libya, you know, just as you see it, it's out of order because of climate change. The climate hazards that are affecting health in the region are similar to the other parts of the world. Temperature is increasing. People in our region are exposed to higher temperatures and for more time. And in hot areas, this is killing actually. I sympathize with heat events here and there, but we are exposed to this 365 days a year, and this is only God knows what will happen to the population. Mortality and morbidity is increasing. There was a heat wave in 2015 in Pakistan, killing more than 1,200 people. Vectors are moving from their areas, causing more diseases. We started seeing cholera in some of the countries where the disease vanished for the past 20 years. Sea level will rise. There are some studies showing that some cities of the region might vanish unless we take action, including the public, the health sector, and everything. The region is dry, and climate change is not helping. It's adding actually to the number of droughts and the number of intensify the water scarcity, leaving people. We've seen currently actually in the Horn of Africa, people are leaving their homes just simply because of drought. Dust storms is one of the unique things in the region. We've noticed that because of climate change, the number of dusty days is increasing, and we know how dust storms are contributing to the air pollution, which is killing hundreds of thousands of people in the region. Starting from COP26, there was the COP26 health program where countries of the world committed, to build their climate resilience and sustainability of health systems. And an alliance for transformative action in climate change health was launched. At the moment, 75 countries, including 14 from the region, are members of this. In COP27, more attention to health was put. Several initiatives were launched, including our famous lung, and the ongoing health activities through the WHO Pavilion. The Ministry of Health of Egypt launched the International Initiative on Climate Change and Nutrition. Several other health-related activities were launched. And just after that, last week actually, we endorsed a regional resolution in the Eastern Mediterranean region. And I think these are the targets of this resolution, which are not far from the needs of other developing countries, starting from building the resilience of the health system, cutting the silos of work between the climate and the health people, improving access to funds, and developing the evidence base to support policy making. I'm not going to talk much about COP28. The COP28 people are here and they will be speaking, but we are very proud that our region will be hosting the first health day ever in the whole COPs that we have so far. Thank you.
Thank you very much, Masen. And again, another historic moment. EMRO will be hosting the first ever Health Day at COP, so congratulations on that. I was feeling very alone here. Can I now invite the panelists to please join me on the stage? Please, come on. Thank you. Wonderful. Thank you very much, all of you, for joining us in this fantastic road to COP28. It's a road that it took us many years to achieve, and it's just, as I say, the beginning of a fantastic plan together. To start this conversation and this setting the scene on what represent the Health Day and what is happening with the health declaration that will be signed, it will be my honor to invite you, Dr. Maha, to talk us about how the COP28 presidency is seeing this historic moment. And once again, thank you very much for that. Yes, go ahead. While she goes to the stage, let me tell you that Dr. Maha Barakat is the UAE Assistant Minister of Foreign Affairs for Medical and Life Science at the COP28 Health Envoy. Thank you, Dr. Maha.
Thank you very much. So, honourable ministers, honoured guests, dear colleagues, it is my pleasure to speak to you today and provide you with a short overview of our plans on climate change and health for COP28. Climate change, as we've heard, is happening now, and its impacts are being felt around the globe. It is already having a very real and tangible effect on people's lives and livelihoods, and increasingly on both their physical and mental health, disproportionately impacting disadvantaged and vulnerable populations. When the United Arab Emirates accepted the role of incoming presidency for COP28, we undertook a large number of consultations with countries and non-state actors, and the issue of climate and health came up over and over again. Many countries pointed to the vulnerabilities and underpreparedness of health systems, while others also highlighted the large health benefits and cost savings that could be gained from early and ambitious climate action. As a long-standing partner and funder of global health and disease elimination, we in the United Arab Emirates understand that climate change can undo much of the progress in global health of the past few years if we don't take action now. That is why we have made climate and health one of our priorities this year, At COP28, our aim is to lift the political profile of this critical issue, and this year's climate conference will host the first ever dedicated Health Day on the 3rd of December, in addition to the first Climate Health Ministerial. In partnership with the WHO and the UAE Ministry of Health and Prevention, we will provide dedicated space and a rich program enabling the vibrant health community to convene and drive this important agenda forward. We have also been working closely with the WHO and a number of countries, including Germany, our host today for the World Health Summit, who incidentally, in 1995, the first COP1, was held here in Berlin. So it's very fitting that we speak today in Berlin. Other countries that we've been working with closely on the declaration have been Brazil, Fiji, Kenya, Malawi, the Netherlands, the United Kingdom, the United States, and many others. And we've been working with them to start articulating some of the key country priorities on climate and health. We have captured these priorities in a political statement of ambition and promise, the COP28 Declaration on Climate and Health, which we are delighted to be launching and previewing today alongside our close partners and champions at this World Health Summit. We are calling on all governments to sign up to our declaration and to work with us to secure commitments and progress on climate and health. We are very pleased to have a set of early endorsers to the declaration, and these include Fiji, Kenya, Liberia, Malawi, and Sierra Leone. And it gives me great pleasure to invite Minister Chiponda from Malawi and Minister Jalla from Liberia to say a few words on this subject. But before handing over to them, I would like to highlight 3% of global GDP. Health systems will need a transformational shift in order to become climate resilient, low carbon, sustainable, and equitable. Second is that the declaration requires significant concentration on finance. At COP28, we want to increase not only the overall amount of climate financing, but also the proportion devoted to health. Today, just 2% of adaptation funding and 0.5% of multilateral climate funding go to health. At COP28, we plan to launch a set of finance initiatives on climate and health, including a pipeline of climate health investments. These will have strong country ownership and can be scaled up to save lives and safeguard health, while materially reducing carbon emissions and other forms of pollution. And third, there's the need to break down silos between health and other sectors in our climate response. We know that in order to keep people healthy, we rely on action far beyond the health sector. Building climate-resistant societies with healthy populations will therefore mean better cross-sectoral collaboration and mainstreaming of health into climate policies. The next round of Paris Agreement climate plans, or NDCs, provides an opportunity to optimize national climate goals so that they deliver the largest possible health benefits. And lastly, I would like to mention that along with our early endorsers, group of champion countries, and health envoys for COP28, Dr. Miriam Nera, Dr. Getinzi, Dr. Omnia, we will be hosting a briefing session this afternoon to preview the declaration and kickstart the endorsement drive, which will run from now to the end of November. So we look forward to discussing these climate and health priorities in more detail with you later today, and we count on you to make COP28 a success. Thank you very much.
Thank you very much, Dr. Maha. It is my honor now to invite to the stage, as mentioned by Dr. Maha, we have Her Excellency Dr. Kumbisek and Dr. Chiponda, Minister of Health of Malawi. Thank you very much, Minister.
Thank you so much. Good morning. It is an honor to share a platform on this very important conversation. A conversation which should have taken place maybe 3 or 5 years ago, because we are talking when we're already in a crisis. As Malawi, we have been facing several cyclones yearly, and the worst one was this year, which came on 11th of March. many Malawians, millions displaced, over 2,000 dead, so many injured. We've lost the infrastructure, we have lost equipment, even healthcare workers, they were not spared. We are still battling cholera, the worst cholera outbreak, which has lasted a whole year, from 2022 January up to 2023. We're still getting cases there, affecting over 60,000 Malawians. We lost about 2,000 Malawians to cholera. Cholera is climate sensitive. We are facing so many crises because of the climate shocks which are happening. So as Malawi, a country, we fully endorse the declaration, and we are so happy that for the first time, health is given a platform at COP28, and we are so grateful to the government of EIA for accepting that we have a health day. We want support from all of you. We understand that we need funding, and we understand that there is funding. Our request as countries is that funding mechanisms, they have to be friendly. You know, you have mechanisms of accessing the funding which are literally impossible. In fact, they're like roadblocks to funding. It's very difficult for countries to access the funds which are available to assist, to build resilience, to build preparedness against the climate shocks. So our request as countries is that let's sit down together and see how best can we make the finance available to countries. We should not have stumbling blocks. We should not have guidelines, conditions of funding, which are like, you know, you are going to enter heaven, where they said the door is very, very tiny when you want to go to heaven. We should not do like that. So that is a request which we are making to all those who have the funds to help us build preparedness, but also to build readiness so that we can be able to, you know, handle the impacts of climate change. With these few remarks, I thank you. God bless you all.
Thank you. Please, Minister. Since we are talking about adaptation, please adapt yourself and sit to my place. We will change the plate name. Don't worry. You have to go? Okay. Yeah, adaptation, you see. Thank you so much, Minister. I was wondering where was a big protocol mistake, but I'm reassured now. Fantastic. My pleasure now to give the floor to the Minister of Health from Liberia. Please, ma'am.
Good morning to all, and I would like to thank my sister. She and I were the only two ministers attending the African Climate Summit, or the last one that they had. And it struck me that more is needed to integrate the health into the policy. Most of the ministers of health are not on board, and most of the countries that have been affected the most are not on board. So there's a very high need for us all to be on board, sitting at this table for the policy changes that will occur. Because if we are not there, a lot of Africans and people in least developed countries that receives or maybe the vaccines or any of the aids would be last to receive. Liberia fully endorses this declaration. We have always had a One Health platform in Liberia where finance, health, or EPA, or the National Public Health Institute, or forestry, all of us have been at the table there. So I was surprised to notice that we're not at the table because everyone knows about One Health platform. But the declaration is more global, and we are glad to be a part of it. Liberia have experienced some of the effect of climate change. We see water rising. We see storms that were not there before. So we want to make sure that whatever we need to support this declaration, to encourage our partners to support financially, and also to encourage our other health ministers to be a part of this declaration. We hope that we can be strong in making sure that all of us are there and that COP28, the health portion, will be successful, will raise enough funding to support all of the countries in terms of health, because there's a benefit for us if we change things. Liberia have also started by changing to a lot of solar system. Some of our new, instead of having generators to put more emission in the air, we're now changing to VSA plant, which is an excellent plant.
Please don't refrain to applaud. Come on, go ahead. I see you refraining, don't.
VSA plant is a better plant and it saves the environment from effects. So we are moving in that direction, and we hope that we can help to support the changes in the climate and to support this COP28 in terms of whatever Liberia can do in its little way to make sure that the climate does not affect all of us, and that we'll be around, and that will not be the next pandemic that will affect the world. Thank you.
Thank you very much, Minister. And it's great that you can stay with us, so take your seat. You will stay with us. Thank you so much for your remarks. I will invite the other panelists to please stay on your chair if you feel comfortable. If not, go to the podium as you prefer. But it will be now my great pleasure to invite a different perspective now. In the last, I would say years by now, we have seen more and more Rockefeller Foundation playing a critical role on climate change and health. And we are very privileged to have today with us Dr. Naveen Rao, who is the Vice President of the Rockefeller Foundation. So what is your perspective from a philanthropist point of view? How do you see this? And how do you think you can play even a more critical role to the magnitude of the problem we are facing right now on climate change and health? Dr. Naveen, over to you, please.
Thank you, Maria. I really appreciate it, and I appreciate the offer to sit and make this a more conversation and more informal topic, because you're right. Philanthropy can take risks and go to places that public sector and private sector cannot. Philanthropy can be disruptive, it can be catalytic. It is not constrained by bureaucracy, that the governments sometimes are constrained. It's not constrained by market forces, that the private sector is constrained. Not only that, but philanthropy can set up partnerships that can actually change the narrative. So as I talk about the role of philanthropy, it is really unique. But if I bring it down to Rockefeller Foundation, the question is, what does it mean? What does climate change mean for us? And how do we adapt? And so what we are looking, the way we look at it at Rockefeller is we have three verticals. We have health, food, and energy. And we've decided to move everything that we do at the foundation for the next 10 years towards climate change. So we're going to look at food, health, and energy through the lens of climate change. And today I represent the health vertical, so I'll talk about the health. At Rockefeller, we simply think of it as three ways that we would be utilizing our philanthropic principles. First is on mitigation, second on adaptation, and the third on innovation. And if you'll allow me, I'll just spend a few minutes. On the mitigation side, we need to decarbonize. That's it. We cannot have any other agenda item that is more critical than decarbonizing. And the healthcare sector needs to lead by example. It's not enough that the healthcare sector keeps talking about health and adaptation, but there's also a role on the mitigation side where the healthcare sector needs to clean up its act. And this is vital. And let me give you an example, and I know you are very interested in this project, solarization of health clinics. How can we get solar panels and make sure the health clinics are both renewable, using renewable energy, but also helping in the whole mitigation process. So that's mitigation. If we move to adaptation, basically we need to be able to adapt to the current health crises that climate change is throwing at us. Those images, I posit that every one of those climate shock images you saw is eventually a health shock. All climate shocks are health shocks. And in fact, health is the human face for climate change. With that in mind, on the adaptation side, we need to be very clear what we need to do to adapt. And two examples I want to give you here is one is how do we get more financing into the hands of people. Like Minister Chiponda said, it's not enough. Right now, there's not enough money. It's not going to the right places. And even if it gets to the right place, it's very hard for those countries to actually get that money. The paperwork is so onerous. So how can we make sure we stay within the adaptation context? And we are also very happy that this year we'll be participating in the COP28 lead up and the Health Day. When I come to innovation, again, climate change has changed the paradigm. So status quo is not acceptable. We need to be able to innovate our way and use innovative processes to get to leapfrog over barriers and to help with the health effects of climate change. At Rockefeller Foundation, we have supported, for example, how can we get digital tools in the hand of community health workers? How can we make them ready for the 21st century? Ironically, these same people have phones and have WhatsApp and do know what is available on the innovative side, but when it comes to their jobs in the day, they still have registers and they have to fill out forms. How can we get these tools into the hands of community health workers to have better health outcomes? That's one example. The other one I can give you is where we are supporting wastewater surveillance. How can we currently dipstick wastewater, especially in communities that are vulnerable, like informal settlements, refugee camps? How can we dipstick wastewater to see what pathogen is circulating? So it's all about detecting and predicting infectious diseases that are on the rise, and can we use innovation to make this happen? And if we do, can we link it with response? So there are many ways that philanthropy can play, but eventually it comes down to being able to partner with others and to be able to come holistically and strengthen local governments for the response and responsibility that is eventually theirs. So thank you for that option.
Thank you, Naveen. Thank you very much. You say it very well. We will need everybody contributing to this societal crisis that we are facing. So it is my pleasure now to give the floor to yet another minister. This time is the Minister of Climate, Environment, Sustainable Development and Green Deal. I love your title, honestly. How do you manage at the government level? And how do you see climate change and health, whether it's becoming a priority on the political agenda of the governments, and what do you think will be the role at the COP28 now that finally we will have a health day, how we can make sure that we will have all the opportunities and not miss it and have a very impactful goal. A lot of questions for you, Minister. Please, Dr. Zakia Katabi, Minister of as I say, Climate, Environment, Sustainable Development and Green Deal from Belgium. Thank you very much, Minister.
Thank you, Maria. Thank you also for your first thoughts and words. And allow me also, as Belgian Minister, to begin by saying to Sweden and to Belgium, we love you and we stand with you. So thank you for inviting a climate and environment minister and this health summit. It's especially great to notice that the interlinkages and the necessary communication between environment and public health stakeholders are becoming more and more evident. There is a need for strengthening cross-sectoral cooperation on climate change and health, and this conference is an example of efforts in doing so. There is an urgency to act on climate change health impacts in Europe as well as across the world. We need to anticipate, prepare, and preferably also prevent the effects climate change will have on our human health. And investing in health resilience and low-carbon health system is an investment and not a cost, as it will save us money further down the line. Health needs to be at the core of climate action, both in our adaptation and mitigation action. In doing so, we need to make sure that we reach and support the most vulnerable. This is key. And there is a need for a just adaptation, and we need to engage and truly hear the concerns of this vulnerable group. I often say that ecological transition, including how to mitigate and adapt to the climate crisis, is the social issue of our century. Health and well-being are closely linked to socio-economic factors. In environmental terms, we can see that low-income households are more vulnerable to the degradation of their direct environment, which in return impacts their health. In Brussels, for example, studies have shown that the poorest neighborhoods are also those with the worst air quality. This has an impact on the health and life expectancy of their inhabitants. People that run a risk of being already more vulnerable because of the jobs they do, that may be more unhealthy as well as more physically demanding. These neighborhoods are also the hottest during heat waves, making living conditions more difficult. All these environmental inequalities accumulate and widen a gap of social and health inequalities within the population. For policymakers, these parallels between socio-economic vulnerability and environmental pollution must guide our action. The ecological transition has a lot to offer in social terms: better quality of the air we breathe and the food we eat, as well as being affordable, better working and living conditions, and better health. A just ecological transition is a lever in the fight against inequalities. We should also make sure not to undermine other rights, gender equity, in the actions we implement, but we need to mainstream climate change into each of those domains. In January, Belgium will take the European presidency. And during our presidency, I will organize a European conference on just transition to assess the existing framework and identify solutions for widening it during the next Commission. In this respect, I have also referred the matter to the European Economic and Social Committee to ask the European civil society what steps are needed to create a more comprehensive framework to achieve a carbon-neutral, fully circular and toxic-free society by 2050. Their opinion will be presented at the formal Council meeting in March 2024, and I hope this will pave the way for a just ecological transition in Europe. Thank you.
Thank you. Thank you very much, Minister Khattabi. With your permission, we will add yet another word to your title. It will be Healthy Green Deal. Thank you. You are nominated Minister of Health from today as well. Thank you. Thank you very much. Now, I asked Dr. Kumar, a good friend of mine from India, to do an effort and to be with us today in Berlin. The reason is that Dr. Kumar, you will see it in a couple of minutes if you don't know him yet, has been one of the strongest advocates on the issue of air pollution and how air pollution and climate change are so much overlapping because the causes, as you well know, overlap on at least at 75%. So Dr. Kumar is a surgeon. He has plenty of titles, but he's a passionate public health officer, if I can define you like that. And that's why I invited him now to tell us, to remind all of us, why are we here, Dr. Kumar? Why are we doing all of these efforts?
Thank you, Maria. Excellencies, my distinguished panelists on the dais, distinguished ladies and gentlemen, a very warm good morning to you. Next couple of minutes, I'm going to share with you some of the pain which I have been suffering every day as part of my duty You might wonder why on duty you suffer pain. I'll show you some images which will explain to you the pain that I suffer. And I'm often asked this question, what a surgeon is doing in a climate change conference. And I show these images and then ask, how can a surgeon who's seeing all this not be there in a climate change conference? So I bring you greetings from Lung Care Foundation and the movement, the Doctors for Clean Air, which we have started because we believe that it's actually duty of all of us, doctors across the world, to bring not something taken from the internet. This is my own picture from one of my patients. This is the kind of picture I see in non-smokers in Delhi. And when you happen to be a smoker also, this is how your lungs become. And this is something I have been seeing for over 20 years. And that's exactly the cause which brings me here to this table. So this is the kind of change which breathing toxic polluted air brings to your lung. Unfortunately, none of you can see because you can't peep inside your chest, but as part of my duty, I see 3 to 4 chests every day, and this is what I see, which hurts me, which is actually what brings me here. We breathe 25,000 times a day, and when we breathe polluted air, it's akin to smoking. There is no non-smoker in a polluted country. You can convert the damage caused by PM 2.5 by this equation. 22 microgram is equal to 1 cigarette. And when a newborn is born in a polluted city, he or she doesn't get any imported air. She or he breathes the same air. So if it's 250, 2.5, which is the case in New Delhi right now, every newborn is breathing or smoking 10 cigarettes from the first day of his or her life. Very sadly, now we have data to show that air pollution doesn't wait for us to be born. It starts affecting us even before we are born. When a pregnant mother breathes in polluted air, the toxins cross the placenta and intrauterine defects, growth retardation, death, premature delivery, and a whole lot of problems occur. So it hurts us even before we come to the world. A lot of people ask me, Dr. Kumar, it only affects the lungs, but what about the rest of the body? I'd like to show them this picture from head to toe. Friends, there is no organ in the body which is spared from the ill effects of air pollution. Lungs are the portal of entry, so they do bear maximum effect. However, from brain to toe, no organ is spared. And expectedly, unborn babies, the pregnant mothers, the children, and the elderly, they bear the brunt of the attack. People often talk of 7 million deaths as the effect of air pollution. I show them this graph. Death is the apex of the pyramid. From normal population to death, there is a long way, and there is a lot of disease and disability which takes place, which actually takes its toll. People often talk of economic consequences of the actions for mitigation. I ask them, when millions of people are getting diseased, day before yesterday, Omnia said that in Egypt, she every day sees young children coming with asthma. Yes, in New Delhi, there's hardly any house which does not have a nebulizer. When I was a child, I didn't even hear this word, but today, every child knows nebulizer, and whenever they have a breathing difficulty, they tell the mom, I think I need a nebulizer. So there are direct cost treatment, there are indirect cost treatment, and can we put a price to premature deaths which take place? I just want to share this slide. I've been operating on lung cancer for 30 years. 1988, 90% of my patients were smokers. They were mostly men in the age group of 50s and 60s. 30 years later, 2018, when I look at my data, 50% of my patients today are so-called non-smokers. I call them so-called because I believe that there is no true non-smoker. 40% of them are women now, non-smokers, and the peak age has come down to 40s. 10% of my patients are in 30s, and the youngest I have seen is 26 years. Why are they getting this earlier? Because they are exposed to the carcinogens from the first day of their life. So I would summarize by saying that in polluted cities, breathing kills. And now I would end by 5 takeaways, which is actually based on 25 years of suffering this pain every day in my OR. Air pollution and climate change are playing havoc with both the health of the people and the planet. I believe it's the biggest health-based existential threat to both the people as well as the planet. And if you look at the causes, unrestricted use of fossil fuels in all its forms, coal, oil, and gas is the root cause, and transition away from fossil fuels in all its forms and across all sectors into renewable, cleaner sources of energy is our only option to save the people and the planet. And when we do that transition, it has to be immediate. It doesn't mean it should end immediately. At least we must make an honest start. It has to be major, which means it cannot be in parts. It should be across the board. It should be effective. It should have short timelines. It should be equitable and just. And now, COP28 has provided us a wonderful opportunity. For the first time, health has been included as one of the important days. So it's a historic opportunity to do so. And as we discuss the road to COP28, I think what is needed is a bold political leadership. I'm sure, I'm an optimistic person, I'm confident that the leaders of the world will rise like good doctors and give the right prescription to save the health of the people and the planet. Ladies and gentlemen, time is running out, and unfortunately, we have no choice. Thank you very much.
Very good. Very good.
Ladies and gentlemen, this is what we call the voice of health and the health argument for more climate action. Thank you for coming from India. Unfortunately, the situation and the lungs that Dr. Kumar was describing are not only happening in India, are happening in many places around the world. According with WHO estimates, and I think I know something about that, 99% of the people around the world is breathing air that is not respecting the proposed standards of WHO on air quality terms. So anytime somebody tells you that we need to slow down on climate action, please think about the color of your lungs, and maybe you will be much more engaged and much more active. Talking about communication, Edgar, I think you are perfect now. Let me see if I can pronounce your name, von Hirschhausen. We know each other for a long time, but I'm still having difficulties with German. He is a physician, but he's as well one of the best communicators, and of course, one of the ambassadors of the World Health Summit. So, Edgar, over to you. What do we do in communication to make sure that this COP will be the most successful ever?
Thank you, Maria. And I still feel your message, Dr. Kumar. Thank you. And we are gathered here to have a clear voice at COP28. And the message is, stop smoking. Stop burning fossil fuels. That's the basic of all the contamination that we have. And I'm furious the more I come to these conferences that every time I have a déjà vu of having more declarations and more panels like this, and we're repeating ourselves. And last time we were here at the World Health Summit, who was here last year? I so vividly remember the moment when the fire alarm went. And this was the perfect signal that our world is on fire and we're part of a problem, and how can we become part of the solution? How can we stop setting the world on fire and at the same time breathe all the fumes that are killing us and our children? I trained as a doctor, and now I try to make this move that we need so urgently at the WHO and at the COP, how to broaden the view from the personal health to planetary health. And I work on public German television, and I brought you some ideas to discuss later on with this excellent panel and you, how we can change the communication. Because I learned science communication, and the hardest thing I can say to you is we're talking about the wrong things. We don't have to save the climate or the planet. We have to save ourselves. And research shows that showing people research doesn't work. And this is evidence. We're more and more driven to do another study and to do another conference, and we think, oh, we have the best arguments, why is nobody following us? And Dr. Rao, thank you for your very precise words. We're not in need of more declarations, we're in need of more budgets for these topics, and philanthropy can play a big role in this. And at this moment, I don't want to say that declarations aren't important. And I want to say hello to Andrew Haynes, the godfather of planetary health, who was here last year. And he's offering his help in getting this declaration really precise. Because it's now 50 years that the limits of growth have been published. We were not anticipating that disinformation and the Merchants of Doubt, I don't know if you're familiar with this great movie, watch it, it's on Netflix, and watch Don't Look Up. Who's seen Don't Look Up? It's, I didn't know should I laugh or should I cry? It's so precise, and we have to break this isolation. And I work on First Channel, German public television, ARD. And what are the images that we're using? We have been overusing ice bears for many decades. And now we look at the IPCC report on television. They're old white men staring at their phones. Is this image transporting urgency? Is this image transporting a matter of life and death? And the next big thing is Credit Suisse. Yeah? Thank you. Bless you. And although I've been committing myself for now 5 years intensely to climate and health, I don't know the guy who was interviewed. Obviously, he had time, and he didn't clean up his room, so he blurred the Zoom. But is any of these images transporting that we have only a decade left to make human life possible? So what we should talk about are values. And again, I give credit to George Marshall from Climate Outreach. He has done a great job on climate communication and politics. And Cornelia Betsch, who is a professor in Erfurt with a Planetary Health Action Survey. This is really science-based. Talk about health, faith, home, justice, independence. What do people care about? CO2 levels? No. They care about family and children, security, food, work, community. Ask people what they believe in, what is sacred to them, what is holy, what has to be kept whole. And then you have a completely different conversation. And why are health professionals so important? Our trust in professions differs a lot. Sorry for all the ministers and politicians. You're important too. But in communication, we need more firefighters. Do you remember Scott Morrison, this idiot from Australia, Prime Minister? The wood was burning, and he wanted to have a press picture for his public relations, and he asked a fireman to shake hands with him in front of the burning animals. And the firefighter said a great thing. He said, "Minister, you will not find a climate septic at the end of a hose, at the fire force." And this quotation went viral, and we need more of that. We need health professionals speaking out, speaking up about all the people dying, as you did. Now, not in the future, not in the next generation. It's happening now. And we need the paramedics, we need the nurses, we need the doctors. We have about 60,000 to 100,000 heat deaths each year in Europe. We have always thought, well, it's a problem of the global south, it's not happening to us. But I think 2023 is really a change-making year. So remember that statistic. Health is the human face of all planetary crises: climate change, biodiversity loss, environmental degradation. And the time for action is now. It's not fair to say, oh, the next generation will sort this out. When I was talking to Maria and to Luisa Neubauer from Fridays for Future, I'm one of the Scientists for Future founders in Germany. What is the role of us, old white men? She said something really funny and precise. She said, well, Eckhart, first destroying everything and not helping in the cleanup, didn't we learn it different at kindergarten? And I think this is the call for all generations to participate and to see that even a 70-year-old today will be affected by this. And I really like the COP in Glasgow for this conversation.
My daughter became suddenly ill with one of the worst cases of asthma, the pathologist says, in the UK. And last year, after a 7-year long battle, we finally got air pollution on her death certificate. So she's the first person in the world to have air pollution on her death certificate.
This was the moment where this huge but inhuman number of 7 to 9 million at the moment became a human story, a human tragedy. And all of a sudden you think, how can we prevent this from happening again? And as you, Dr. Kumar, said, the child, her 9-year-old daughter, the pathologist said it looked as if she had been smoking for 20 years. And this, as a father, breaks our heart. Who has children? Who loves their children? There are moments, I know, but there is a treaty in humanity that has been there for ages, that we want our children to have a better world than we had. And our generation is breaking this treaty. How are we going to respond when our children ask, what did you do in 2023? What was important to you? What did you know? What was the power that you had? And how did you use it? And I wish we have good answers. So let's use other visuals. Let's use the storytelling that we have not only in science, but also in fiction, like extrapolation, like Don't Look Up, or Joko Winterscheid, for all the Germans, did a great job on Amazon Prime. Let's talk about freedom. Let's talk about the Statue of Liberty, that she can't breathe anymore. When the woods are burning in Canada, and you take out your FFP2 mask, not because of virus, but because of PM 2.5. So, to conclude, we have everything to lose, and still we have a lot to gain. Let's talk about the co-benefits. Let's talk about the world we want to live in, and that having the possibility to ride on your bike to your job is not a bad world. To have cities with green on every roof, on every balcony, to clean the air, to have it cooler is not a loss, but a gain. To have a planetary health diet in every hospital on this planet, and to stop serving patients and colleagues and workers this stupid beef that's killing the animal and the atmosphere and the soil at the same time. And you mentioned it, why isn't there a solar panel on every health institution? If you want to know more about our work, please check our website, check our social media channels, talk to us. I want to appreciate the work of our team. Please stand up, Donald, Sophie, and Kerstin. The most important thing, it's hard to save the world on a voluntary basis when other people are destroying it professionally. And so the most important thing a single person can do today is not to stay single. Get in contact, form alliances that they haven't been, from media people, from storytelling people, to philanthropic people, to health ministers, to WHO, and never forget, let's use this COP28 to stop smoking on this planet on a big scale. Thank you.
Thank you, Dr. Thank you very much, and very provocative as usual, but still we need to provoke, definitely, if we want more action. Believe it or not, we have time for what we wanted from the beginning, having some Q&As, having some interaction, and of course I will, before that, giving the floor to our panelists, if they have something else to add or something else to say. Naveen, I'm looking at you, you say yes. Go ahead, please.
Thank you. Listening to all this, it's been very interesting, and I appreciate both my heart and my head have been engaged here, and I really appreciate it. One thing I really wanted to spend one more instance is the importance of partnership. I know this came up. Traditionally, people have always talked about it like as a golden triangle, where the government sits at the top of the triangle, private sector on one side, and then public sector, civil society on the other. And all three need to come together because this issue is too big for any one sector to solve. I mean, we've always looked at our own sectors and kind of moved people into silos, but if you don't break that and if you don't come together, and just as an example, leading up to COP28, along with our partners, Wellcome Trust, and the Global Health Alliance, Global Climate Health Alliance, and AMREF, we're trying to bring ministers and trying to see how we can show up at COP28 to really break this triangle down, to make it a circle, and make sure that we all work together, and otherwise it's not going to happen. So as this mindset of partnership needs to really get into our skin and into our modus operandi.
Thank you, Naveen. And I know that, thank you. Prepare your questions or interventions if you have it very, very short. Dr. Maha, I know you want to react as well. Please. What a responsibility, no pressure for the COP28. It's okay.
No, but we're very grateful to the speakers on the panel today for giving you a first-hand finger on the pulse of what it really means to people trying to live through climate change. We saw images of people dying from flooding. We've heard we've heard non-communicable disease issues of lung cancer from Dr. Kumar. We've heard about the 9-year-old who died from asthma due to air pollution. We've heard from the Honourable Minister from Malawi about cholera. So they had a flooding in Malawi, and what killed people in addition to the flooding was cholera setting in, resulting in more deaths than the whole of the COVID pandemic in Malawi. If we can add to the other communicable diseases, it'll be difficult to talk about climate and health without mentioning the word malaria. Malaria, to this day, is killing hundreds of thousands of people, and those targets the targets that have been set by the international organizations are not being met. In 2021, 619,000 people died from malaria, an entirely preventable disease, most of whom were children and pregnant women. And these numbers are expected to go up rather than down. So all our previous predictions were that the numbers would be going down slowly until we meet our targets in 2030 and 2050. We're not going to meet those targets, and the funding gap is still there. We need an extra $500 million upwards if we're going to try and achieve the Global Fund's target of reducing malaria deaths by 50% in the next 5 years. So climate is impacting all of this, and the most vulnerable people are the ones that are taking the brunt. So I thank our speakers and the passion that they bring to this issue, and really it needs a joint effort. Hopefully, working together, COP28 will catalyze more action. And as we've heard, words are not enough. We need to look back at COP29 and COP30. So once we're in Brazil in COP30, we need to look back and see measurable outcomes from the words that you've been hearing today. So thank you, and over from me.
Thank you very much. Yes, I'm looking at the Ministry of Health from Liberia.
I would like to thank you for that great presentation. I think all of us is walking out of here wondering what our lungs look like, which color is it, even though we haven't smoked. So I can imagine our mothers who have been for many years using coal and using firewood and other things to cook. It touched my heart from that presentation. But also, I just want to say that I hope that COP28 declaration will not be like all of the other declarations that we have had over the years. We keep reviewing and reviewing, and there's no results. So we hope this one is result-oriented and as soon as possible, because the world cannot wait. Thank you.
Thank you very much. I'm sure Dr. Kumar will want to say something. He's passionate about
Thank you again. I believe that to solve a problem, being aware about the magnitude and the consequences of that problem is very important. And that's why, as a doctor who's traveled across the globe talking about this issue, I feel that awareness creation amongst masses is an essential component. And taking off from what Navin said, that we have this triangle of government, private sector, and public sector. So all of them can come together if awareness is created. I have seen in my country, so we have a festival in the month of November where a lot of firecrackers are burnt, and that's a major cause of spike in pollution. The Supreme Court ordered that it should be stopped, but people did not follow that, and Supreme Court can't go. So I thought that if people are aware that the court is not giving this order for their benefit, court is doing it for the people's benefit. So awareness generation is very important, and I think doctors have a major duty to play to take this message of these lungs to nook and corners of the world, that this is what is happening inside it's not an environmental issue, it's about your health and it's about your child's health. If you care for your child, which all of us claim to, you cannot ignore this issue.
Thank you, Dr. Kumar. A couple of things. One is that this COP28, for the first time ever, we are having this health day, which means that for the first time ever, all ministers of health have been jointly invited by Dr. Sultan Jabbar, the president of COP28, and Dr. Tedros, the Director General of WHO, and the Ministry of Health of the Emirates, of course, co-signing. So all ministers of health have been invited. We will have a very big representations of ministers of health, but not only. We want to reach COP28 with the voice of the health community at large. So we will be mobilizing this health voice, making sure that not only the ministers of health representing us will be there, but all professionals, from nurses to doctors to anyone working on science, academia, anyone working on public health, we are calling, WHO wants to have with the international community the voice of all of them represented. And my second point is about legislation. You mentioned that the rule issued by India government not very well respected, but we maybe are underestimating the role that sometimes legislation can play. And I'm referring to what you presented before of the Ella Roberta, this little girl, 9 years old, who passed away with a horrible form of asthma. And because her mom has been fighting for 10 years, Rose Moon, you saw her image, she managed to change. And in UK now, for the first time ever, air pollution has been recognized on the birth certificate of this little girl. My voice is just like this because I've been talking a lot. I did a lot of tests and they are all negative. So it's just to reassure you that I'm okay, not infected.
I've seen you smoking outside.
No, I never smoked. Never, ever. So on that one, I'm super clean. I have other problems, but no, not really. Anyway, anyone who wants to, please identify yourself. Can somebody help me with the microphone? Come in. Thank you.
Hi, good morning. Thank you very much for this very interesting panel, for the good presentations. My name is Tobias Luppe. I work with KfW, German Development Bank. I have two questions. One issue that was mentioned by the Minister of Health from Malawi, and I think it was mentioned also in the panel, was we need more funding for climate and health, and we need to unlock the existing funding and make it more accessible. Naveen, maybe you or maybe others can share some light on what do you mean with unlock the existing? Would that be, for example, a reform of the Green Climate Fund, or what could that mean? Second question, we've heard that there is the big declaration at the COP, and we've heard a number of early endorsers, all from developing countries, who, as we know, bear the brunt of climate change. Now, Minister Kadabi, as a representative of industrialized country, will you be among the early endorsers this afternoon, or what stops you from early endorsing this declaration? Thank you very much.
Thank you. Did you get the question?
Sorry?
Is that okay, the question? It was clear? Good. Excellent. You want to start? And then maybe Naveen, you want to take the other one?
Just maybe I wanted to react to your first question and then I come back to the second. I also, when I read my discourse, I was wondering if I should have to speak also about the situation outside Europe, so I decided not to do it. But what I told about citizen, it's the same dynamic. Need of solidarity.
Closer, yes.
Like that? Okay.
Better.
So I choose to speak from my own perspective, from the European one, but it's clear that all I've said about solidarity, about poorest citizens and so on, you see the same dynamics between countries and states, and so we have to work on the same dynamics, and the reality is the same. It's also the poorest countries who are facing in the most violent way the climate change. So I can also only say that what we see at not a national level, but even at a citizen level, it's the same dynamic on the country's dynamic. But also the first question about budget, I'm convinced that we need more budget, but I'm also convinced that we need better budget. I say it always in my government because it's not easy to have funds for climate actions. It's clear, and I say it. We just negotiate our budget, and I'm ashamed on how we are treating the climate issue when it comes to finance and budget. And so I'm also advocating for more budget, but also for better budget. We have some budget who have to, with the same budget, we can do something else and better. So I think that we have to argue for both things, more budget, but better budget, better investing, go out from the fossil investment. My own government continue to invest per year 20 milliards of euros in fossil industries. So I don't ask to my government more budget, I ask them to go out from those investments and to invest the same budget in decarbonizing our industry and so on. So I think that it's the first step, because we know how, well, Minister, you know when we negotiate a budget how it's difficult. So maybe if we begin to ask to only change the orientation, it will be a first important step.
Thank you. As you well know, talking about financing, the best, one of the first thing we need to do is to stop giving subsidies to fossil fuels. With those 7 trillions that are spent now on fossil fuel subsidies, we could provide universal health coverage to the entire world. So thank you very much. Naveen, Dr. Maha, and then I will go back to the public again. Yes, wow. So quick response.
Yeah, quickly. So my understanding, the question was on financing. It's easy to say we need more financing. I thought the question was a little more details on how, for example, the philanthropy section and Rockefeller is looking at it. Less than 1% of all adaptation money goes towards health. We believe truly in supporting the Bridgetown agenda. The Bridgetown agenda is very simple. It's not simple. It's very complicated, but simply put, it talks about debt relief. It talks about blended financing. It talks about concessional capital. It talks about how do we get more financing to the right countries that comes to them without strings and comes to them in an easy format to be able to leverage and use. So I would strongly suggest those who are unfamiliar, there is a website and it's easy to understand, but I think we should all support the Bridgetown agenda. At least that is what Rockefeller is doing.
Thank you. Dr. Maha?
Thank you. So again, a very important component of the climate and health agenda of how can we adapt and deal with the problem. At UNGA, for colleagues that were at UNGA in September in New York, the Rockefeller with the Global Fund and the Green Climate Fund chaired a very important meeting to look at how they can collectively work with funders and major multilateral development banks. And they're working on a collective set of shared vision and shared principles which will help lead the way for dealing with climate and health specifically. So there is there's a pie, if we can use that terminology, for funding for climate in general. The pie needs to be bigger. We can't eat into the money that's been allocated for other climate responses. So the initiatives that are being looked into, including the Rockefeller and the Global Fund and the Green Climate Fund and so on, and other players, we're looking at new mechanisms for generating additional funding that can be specifically targeted for the climate and health nexus. There is no alchemy, unfortunately, and we have to be very strategic on how we can do this. I hope you will be satisfied at the announcements that will be made during COP28 specifically on this topic. So there's a huge amount of activity in the background in the lead up to the COP28 session in Dubai, and hopefully you will be pleased to see the announcements that will be made at that time. Thank you.
Wonderful, thank you. Plenty of questions. Please, in the first row, Ina, introduce yourself very quickly because they are reminding me that we have 10 minutes and I would like to take all of you. Please, go ahead.
Of course. Thank you, Maria, and thank you to all the speakers. My name is Ina van Francis. I'm part of the German government. I work in Geneva at the mission. Eckhart, I was a bit sad when you said we don't need more declarations because, I mean, the COP28 presidency has been working so hard together with us as the group of countries on that declaration of the Health Day, so I feel the need to defend our honor a little bit. So I would like to give the question back to you. I mean, you know political processes. This kind of declaration is the process to bring decision makers on board. So it is the way we have to work, and it's the instrument that we have at that level. So I would like to bring the question back to you. What would you like to see in that declaration? And what would you like to see happen at the COP28 so you feel we are making progress and joining the nexus of climate change and health better? Thank you.
Thank you. Please, the gentleman sitting next to Ina, introduce yourself. And then, yeah.
Thank you very much. Dr. Jean-Paul from Maltesa International. I'm very interesting with the presentation, and we know now there are many no communicable diseases because of indoor pollution and air pollution, also for the food no safety, like pesticide, mycotoxin. And then we would like now to integrate the prevention before all within One Health approach. And also is very important to integrate the good approach for communication. Because if we communicate the difficult of people can be mistrust. We want to communicate the best approach, community communication for trust of all people. Thank you very much.
Wonderful. Thank you very much. A couple of participants there. The lady in white, and then the gentleman next. Over there, please. Did I see you? And then you will be the last one. Oof. Not sure we can.
My name is Anja Schönmüller. I'm a youth delegate here and a student in medicine and political science. And I would like to ask, where are the young people on this panel? Because you talked a lot about young people being affected the most, and I'm active with Health for Future here in Germany, and there are many young people who are...
You are fully represented, and as you know, we have a special session with your youth representative and myself yesterday, so definitely you are 100% of board. Yes, thank you.
Yeah, thank you very much. Good morning, everyone. My name is Dr. Sahan Enabulele. I'm the immediate past president of the World Medical Association. I come from Nigeria. Similar to what she said, when I look at the panel, I see a panel of the converted. People who already know about these issues and the devastation. I do not know if we are aware of what is happening in some parts of Africa, including my country, Nigeria, where a lot of this climate crisis and, of course, untold harm on the health of people is being caused by oil exploration companies, the multinationals. In fact, there were studies we did in 2 states of Nigeria where we found out that the works of these oil exploration companies, in fact, has caused very tremendous air pollution, apart from the pollution of the seafoods and all of that. So the question I ask is, how are we engaging these very, very serious destroyers of our climate, of our economies, of our lands, our agriculture? I want to see them on the panel to also tell their stories on why they continue to undertake these activities that are undermining the health of the people of the world. So beyond those who are already converted, let's also have the story from the other side so that we can have some level of engagement. Because if you do not engage them, like the doctor from India said, in terms of awareness, they may be doing these things out of ignorance, apart from their profiteering propensities. So I suggest that we bring them to the table to tell us why they continue to undertake these harmful activities that pollute not only the air, destroy the agriculture, seafoods, and of course the livelihoods of the people. Thank you.
Thank you. And the last question. And I'm afraid we need to close. Yes, we need to close. Yeah. We can't hear you, sorry.
Thank you. My name is Esther Basaris. I'm the MP for Nairobi in Kenya. What I'd like to ask is, first of all, I'm very, very happy that health is going to be a big issue when we get to COP28. The Global South, if COP28 does not deliver, will not attend any other COPs. Because from 2009 in Glasgow, we've been made so many promises, and the Loss and Damage Fund has never been set up. So what I would like is, we have an example of debt for health, that Côte d'Ivoire had a debt for health. So can the people that are attending the COP28 call for the wiping out of all the debt in the global south, so that we can use that money to develop health and to also recover loss and damage? And for the companies that are actually gaining carbon credits and not gaining them from Africa and the global south, I really think there's a call for action there. So if we're really talking matters health, we really need to make sure that we champion debt for health, so that we can have that money to be able to recover loss and damage and to be able to save the lives that we need to save. Thank you.
Thank you. Thank you very much.
Maria, I want to answer the question.
I'm sorry, but they are really reminding me that we need to close. I'm afraid, just a question. This is starting a conversation. Please, for those of you that can afford it, stay a little bit longer, and maybe you can answer the question to you, Edward. This is a conversation that needs to continue, that for sure, and this is the beautiful part of that. I would like to take this opportunity to once again thank COP28 presidency for giving us this opportunity of having the Health Day. I would like to restate again from a WHO World Health Organization point of view and all the global health community, yes, climate change is affecting on a very negative way the health of the people in terms of more infectious diseases, more vector-borne diseases, more waterborne and therefore cholera, non-communicable diseases, mental health, massive displacement, problems related to food shortages, so definitely affecting dramatically our health. And that's why we need to respond by saving lives and responding and addressing to those problems already created, reinforcing the capacity of the health system, the health sector. We need health systems that will be better prepared, climate resilient, adapted, low carbon. We need to make sure that we have the health system that fits for the 21st century and respond to the needs created by climate change and exacerbating the health problems we are facing. We need the positive part of that as well, and the positive messages are related to the fact that if we take action on accelerating the transition to renewable, clean sources of energy, we will reduce air pollution, we will reduce millions of deaths. If we accelerate the transition to sustainable food systems, we will have healthier diets and reducing by millions the number of deaths occurring right now. And if we accelerate the transition to healthy urban planning, we will reduce millions of deaths as well caused by exposure to air pollution and other injuries that are occurring in sedentary lifestyle in our cities, in our urban environments. And yes, we need to play our part, leading by example, by reducing our own greenhouse gases emissions, our carbon footprint at the health system. And yes, we need the financing. We need to stop the nonsense of financing giving subsidies to fossil fuels. We need to unlock funds for the health sector. We need to mobilize the financing and make sure that the ministers that will be at COP will come back with some hope on their hearts, but on their pockets as well. And yes, we need to mobilize the health voice, because only the health voice and the health argument is the one that will make possible more climate action and more responses and more impact, and creating a better society for all of us, and the one that will protect our health. Thank you so much for your attendance, and see you soon at COP. Thank you all.